Hello, everyone, and welcome to another episode of The Big Idea. Thank you so much for joining us. I'm your host, Jason Seymour. I'm the spokesperson for the U.S. mission to the Association of Southeast Asian Nations. Our mission started this show because we know that Southeast Asia is filled with leaders who not only have big ideas, but they turn these big ideas into a reality. And we do have a very special guest, one of these leaders with us today. His name is Dr. Daniel Ting, and I want to welcome you to the show. Welcome.
Thanks, Jason. Hi, everyone. It's Daniel here from Singapore. How's everybody doing?
So glad to have you with us. Dr. Ting is an ophthalmologist and a researcher and has so much to share with us today, not only about eyes, but a topic that is of great interest to him, which is AI in the public health sector. So we're going to get into our conversation, but just a quick reminder to everyone in the audience, we want to hear from you. We want to hear your questions, so feel very welcome to put them in the chat room and we will do our best to get to them within the time that we have. So Dan, let's start with AI in the health sector. Tell us, what does this mean? What is this phrase?
Yeah, thanks, Jason. Right now, as we are all aware, COVID-19 has hit us really hard since last year. And causing, millions of deaths and millions of people getting infected and stuff. And many people have lost their families. And yeah, so it's a really unfortunate event that has happened, that has hit the world in multiple ways. And, AI, it's artificial intelligence, and it is actually not a new concept. This is something that I would like to share with the audience. It was actually started being described back in 1950s, and the machine learning, the terminology has been first described back in 1980s, and the new kids in the block is called the deep learning, and that has been actually even described back in 10 years ago. So how is AI and relevant, in the context today is something that I hope we could actually spend the next 30 to 40 minutes to talk a little about. And for deep learning, it has the concept actually is not new. Actually, it was first described back in the late 1980s, by someone called Geoffrey Hinton. So if everyone is interested in AI, machine learning, and deep learning, I would strongly encourage you to read up these three big giants in the AI domain at the moment. They are the Geoffrey Hinton, Joshua Bengio, and Yann LeCun. And jointly, they have actually been awarded the Turing Award, which is the Nobel Prize equivalent for computing back in 2019. So, the paper they published, the paper that they published back in 2015 is one of the landmark paper that has actually described that the deep learning is a new novel machine learning techniques that allows the data. It can be an image, it can be in the natural language processing, can be in speech and motion and stuff, to be analyzed by multiple processing layers. It's like a human brain's multiple layers of neurons to analyze each of the individual pixels from the pictures, for instance, and with multiple levels of abstraction. So if I'm trying to actually make it as layman as possible. I can be here so that
I'm fine with you.
Yeah, and this deep learning has been heavily adopted in a few big domains, namely the image. So if you guys are using the Facebook, Instagrams, and if your face are automatically tagged, this is exactly what deep learning is doing. And I'm sure a lot of people are using the iPhone, the Siri, and talk to me Siri, and that is by something called the deep speech, the deep learning for speech recognition. And if you are using the chatbot and to log into any digital services, and sometimes you may be even feel that you're talking to a real person until like someone say, yeah, now speak to the operator. And then, for the last 5 minutes, you're talking to someone virtual. So those are the, the technique that's been used in the non-medical world. And how is that relevant to the medical world, right? I mean, this is really what the topic is about today. And how is that going to help mitigate some of the risks of COVID-19, and how is that going to predict where, the COVID-19 is going to spread? And yeah, so those are the big problems. What is the impact right now for COVID-19 in the healthcare setting? Let's talk about a few, right? First is it has actually resulted in the, increased risk of the infectious risk and also the exposure risk, right? Both from the medical personnel and patients, populations, and the frontline workers. And the patients, a lot of the countries, when they are experiencing the lockdown, the patient can't actually come into the hospital. Literally, the appointment has been deferred or delayed, and some of the patients, unfortunately, are also suffering from the delay of treatment that they have resulted in either morbidity or mortalities. So those are the big problems that the healthcare sectors are experiencing globally. So how can we actually tap onto AI or digital, the services and some of the virtual platform for telemedicine, for healthcare deliveries? And these are some of the things that has catalyzed the digital transformation that's happening in the healthcare setting right now. So, I mean, I just wanted to stop here and just to see whether, Jason, you have any questions for me before I start talking for another half an hour by myself.
Lots of follow-up questions, but one thing that you mentioned, which was particularly interesting, was that AI can be useful for predictive models.
Yeah.
And do you have any examples? Has AI helped COVID researchers as they look globally and they're looking to prevent the next outbreak? Are there any specific examples where AI has been useful to do so?
Well, I think this is a million dollar questions, right? How can we leverage on the big data analytics to predict the next outbreak is going to be, and people were asking, right? How could we have used the previous data in when the MERS or the SARS, when they actually has hit us? Could we have used those data to predict whether COVID-19 to have prevented COVID-19, or can we actually predict the next outbreak? I must say, I don't really have the answers to this, and it's quite challenging to actually build such model because, as you know, I mean, all these crises are really determined by a lot of the confounding factors as well. And right now, we don't even know the source of the COVID-19. I mean, there's lots of debates about where is the origin of COVID-19. It started in Wuhan, but a lot of the controversial statements has followed since then, and whether it is some sort of is a natural disaster, or is it something biological? And all these things is we don't have the answers to this. I'm afraid. So if we do not have a good training data sets to build an AI model, this is no different from saying that, oh, hey, I have 100,000 images, and can I use the AI to build something? I always get these questions, right, in healthcare. Say, oh, I have these data sets in my hospital for the last 15 years. I mean, is there anything AI I can do with my data sets? Then the first question is, I always go back down to the basic. How good is the data, and how well curated is the data? Is the data representative of what you want to do, and whether these is something that you wanted to deploy, within your healthcare setting? So how can we actually leverage on all this big data to predict the next outbreak? I don't have the answer, but a lot of the researcher around the world has gone into this domain. I feel it's a super exciting domain. But having said that, the COVID data has been used to predict the spread. I mean, across the spread of COVID across the globe. And you can look at some of the papers as published in Lancet, the journal. And one of the paper actually has really effectively used some of the COVID-19 big data to predict the pattern of spread, and then the risk of some of the preparedness of some of the countries to handle COVID-19 if it ever gonna hit. So those are the things that has allowed people to kind of assess the risk in terms of the respective countries, in terms of their preparedness to fight COVID if it ever hits. So those are the few things that big data has helped. Of course, the deep learning in terms of building the COVID-19 detection. If you run a chest X-ray, whether this patient has an active COVID-19 or this patient do not have just a pneumonia not related to COVID-19, is something that has also been extensively published in the literature. So, and then of course the Johns Hopkins COVID-19 dashboard is something that has also been heavily adopted right now for us to track the COVID-19, the spread, the distributions, and the trends and stuff. So those are the some of the few examples that in fact we have actually published a paper last year together with Larry Kareen from Duke previously, and some of the Duke faculties. We published this paper that has been quoted by the US CDC as well in the Nature Medicine paper. So those are the few examples I would like to share. Yeah. In response to what you just asked. Yeah.
Sure. Well, I just wanted to make a couple comments in response to that. First, it is really an exciting time to be a scientist in 2021 because the international community works together. People are sharing things. I mean, 50 years ago, 1950, you'd have to mail things. A mail would take 2 months to get from one country to another. Now you can have all these scientists working together very quickly, sharing data, sharing information. And the other thing that I wanted to say about AI, which is important, you mentioned this isn't really new. We had Hinton talking about this in the 1950s, but when you look at the course of human history, I mean, it's still pretty new. This is an exciting time to be alive. We're just progressing so quickly, and scientists will need some time, and data analysts will need some time to look at this data and figure out what is the best way that we can use all this information. So I do see that we have, So I do see that we have a comment from our audience. This is from Brielle Tam. I hope I'm saying your name correctly, Brielle. And Brielle says, AI helps us who study in the medical field. Brielle is a second-year medical records student. And she said as part of her program, they are looking at how IA will be implemented in this medical field. And she's specifically talking about radiology tools and increased accuracy and how it will replace the need for tissue samples. Now that's interesting because a lot of patients, just to have their bodies analyzed, sometimes have to go through painful or challenging procedures to have something extracted from their body. Now, how will AI prevent the need for taking tissue samples? What does that mean? Are you familiar with that?
Yeah, well, I think that is a great question. In fact, the question, well, is something that, in fact, we were just discussing last week in the lab and see to explore whether we could use the radiological imaging, be it a chest X-ray, CT imaging, or MRI imaging, to predict some of the pathological diagnosis. I believe this is what she was actually after. Can we use radiological imaging to replace some of the pathological biopsy, for instance, to actually get the tissue samples and then send for pathology as a specimen for analysis? And this is some of the very powerful domain that I think a lot of the peoples around the world are looking at. Can we use a mammogram, the picture, to actually predict these patients whether they have a benign tumor or versus a malignant cancers, and just purely looking at the image as well? The short answer is this: is that if you have enough data to train, and if the disease, the characteristic of the disease are very pathognomonic on the imaging, the short answer is yes, it's possible to be done. Can you use the CT imaging or MRI imaging of the prostate, to predict whether this patient have a benign, enlargement of the prostate gland versus prostate cancers? And this is totally doable. And in fact, some of these findings have been published in the literature as well. So, can we even use the current imaging together with the data to predict the incident or progression of the disease, say in 3 years and 5 years time? This is also another very powerful areas that many teams are currently looking at as well. So, I'll just take it for example. You mentioned about, can AI actually, I just want to digress a little, right? What is the role of AI, in the medical field right now? Many physicians, surgeons are asking me, are we going to be replaced? Big questions.
I was thinking
People are worried. Yeah, people are very concerned about this. Like, are we talking about Skynet, the Terminators? Are we like going to be replaced by robots and AI and stuff?
Yes.
My short response is that, right? Treat AI as your friend. Treat AI as your enabling partners, and get AI to do something that you really hate to do, and is something really boring that you really dislike doing. So and AI right now, it can actually be designed as two big models, right? One is a fully autonomous model, and one is the semi-automated model, where we actually say AI as an assistive tool. And how I think AI can come in is under very much at the assistive manner, right? So if we actually had to see, say, 50 patients per day, and if we only have 4 hours, literally all the patients, especially in the big metropolitan hospital, where and plus right now we are currently at the COVID-19 pandemic crisis, a lot of the waiting time has increased, and the backlog of patients that needed like urgent help. How do we actually get AI to help? And I think AI could be very extremely useful to highlight some of the things that really require some extra attention. And not only that, right? And you can also filter out those normal scans that do not require any specialist or medical attention. So those are the things that I feel AI can come in very, very nicely to fit into the medical care. And these are some of the things we don't really like to do as a specialist anyway. It's boring. And then, can you imagine looking through 200,000 of the normal scans? How boring can it be? Can our attention not to be diverted to the patient who has, there's a few different lumps in the x-rays. Is this benign? Is it, is this cancerous? So I think we're talking about changing of the job scope of the medical practitioners in the next few decades with the AI coming on board. And we're also talking about changing of the skill sets of the medical students or the residents who are entering into the different training programs. We are currently looking at how we could actually set up the medical curriculum, no different from how we actually encourage the audience to, the medical students to learn about the basic statistical skills, analysis. But now I think the AI would actually be included or incorporated as part of the curriculum as well moving forward. Yeah.
I just want to add to what you're saying that I would say 99.9% of physicians, they want all the information they could possibly get because they want to heal their patients. They want to diagnose whatever malady they're facing accurately. So I know what you mean, that some physicians are worried about being replaced, but many physicians, they would love to have a real crystal ball that could predict what this patient is going to need. So I would imagine overall physicians are excited about this prospect. Now, I just want to clarify something. So you focus on the field of ophthalmology, but you also focus on AI. Is there a link between the two that you find interesting?
Oh yeah, so I mean, I started doing the AI in ophthalmology field because clinically speaking, I practice as a retina surgeon. So, I fix a retina detachment, as a secondary cause of the very poorly controlled diabetes, the macular work and stuff. But I mean, the other part of my job is to actually drive the AI research in ophthalmology. I mean, I started that about 7 years ago, and one of the papers that we published back then was to use the deep learning system, to automatically detect three of the potentially blinding conditions, namely diabetic eye problems, the glaucoma, and age-related macular degenerations. I think this is quite a commonly used medical terms, and I won't be surprised many of the audience would be quite familiar with these diseases. So, I mean, just like any other technology, the basic principles of building an AI system for ophthalmology or chest X-ray, radiology, dermatology are quite similar, right? So those are the things that I would like to share with the audience. So when we build an AI system for any medical imaging field, we broadly usually divide it into two big domains, right? One is the dictionary, and second is the brain. So what is the brain and what is the dictionary, right? So I mean, it's no different from how human is actually learning, right? As you progress, you learn, you read books, different books, and dictionaries and stuff, and then and of course we all have a brain. So what is the brain of an AI system? So we talk about convolutional neural network, right? CNN. So we talk about there's a different types of CNN that's available in the literature right now. So it goes from AlexNet to VGGNet, ResNet, DenseNet. This is a bit more technical for the audience, but for some with the technical expertise background, who's actually listening in, and this is just no different from adding more and more layers into your brain. And the more layers that you get, so I mean, it was supposed to make you smarter, but of course there's also a whole new topic to see how, I mean, even with the increment of the layers within your brain, it doesn't mean that you will be smarter. So that's one part. What about the dictionaries, right? The dictionary consists of the clinical data, the imaging data, and it could be also a genomics data as well. So those are the things that actually are very similar, irrespective of the specialty. So if you know how to do the ophthalmology AI well, potentially if you have learned enough experience in terms of building the software, you could actually use exactly the same principle to build, say, mammogram AI system. You can build like a skin photograph AI system, ECG AI system. So those are the basic principles that are quite similar. It's just the intended use environment is usually highly guided by the respective clinician. Where is the clinical unmet need that needs to be addressed? But once you actually get the intended use environment sorted, the rest of the clinical data sets, the training, the validation, how do you appraise the AI system using the appropriate statistical methods and stuff like that is usually quite straightforward. But again, once we build that, then the big question will come: how do we integrate that into the clinical and the digital, the ecosystem, complying with the IT security, data privacy, data governance, and those are the things that is also, again, it makes another very challenging part when we're trying to integrate the AI system back into the clinical workflow. Who's going to pay for the cost, and is it going to be cost effective? So those are the few different big, the questions that would the AI researcher would need to start answering as well.
Exactly. You're raising all the questions, but we don't have all the answers yet. And I'll just add one more question, and that's from another audience member named Jeremy Lim. Very, very complex question. So I'm going to pull a piece out of your question, Jeremy, and that is, he's touching on something a lot of scientists are concerned about. You spoke earlier about the accuracy of data. And I'm wondering, with the evolution of AI and AI research, will it assist to eliminate the bias and the different cultures and the ways that different countries approach science so that we all are able to work together more effectively to come to accurate conclusions?
Yeah, I think the AI bias is a very extremely hot topics right now within the machine learning and medical field. How do we build an AI system that is free of bias? The short answer is impossible. We are always have bias, and AI system is always built on the clinical data sets. And clinical data set, so long as it's actually being determined by a certain practice patterns, and you can actually vary from country to countries, and that would actually create bias. But how do we mitigate bias, right? So you cannot eliminate bias, but you can mitigate the bias. How can you actually test one of the AI system to be generalizable to different population, ethnic groups, different clinical settings, whether it's in a tertiary, secondary, primary settings, and the different races, or even different imaging devices. Different imaging devices will give you a different, the image specifications when you actually capture them. How do you, make sure that is something that when we actually build an AI system, we would actually, and I personally sit in quite a few editorial boards when, of the medical and digital journals. So when I see a papers like this, the first question is, how generalizable is this? And then how many independent testing data sets have you tested your AI algorithm on? And whether or not all this population that you're tested on is reflective of the population that you're intending to use such AI algorithms. So US FDA has always encouraged the AI researcher to build the AI system within the intended use environment. So this is very, very important. How do you create enough testing data sets to be sufficiently powered to be reflective of what is happening in the real world setting? Very important. Hence, the power calculation, it's no different than how we actually conduct clinical trials, assessing the different diagnostic devices, or the efficacy of a certain medication. So same thing for AI. You also have to do a similar approach to make sure that the AI algorithms is in fact generalizable to other population. So we talk about bias. And what about facilitating a cross-border collaboration? Say, for example, if in Singapore, Singapore is only a 5 million population country, and we do not actually have enough conditions to build an AI system to detect certain rare conditions that we don't see in Singapore. How do we facilitate a cross-border collaboration and without even sharing the data? So in fact, in the machine learning field right now, there's something called the federated machine learning platform, where that allows the different countries, say for instance, if I were to build something to detect a breast cancer using a mammogram scans, I only have 500 in Singapore, UK has 1,000, Hong Kong has probably 2,000, and US probably have 10,000. How do I actually create a model, gathering the 4 different countries' PIs without sharing the data, across, because we are all limited by our respective countries' data governance rules, the patient's privacy rules? You can actually adopt something called the federated machine learning approach. Yeah, so those are the few advancement in the AI and machine learning field that allows a cross-border collaborations while still maintaining the patient's privacies. So those are the few, the exciting part of AI and machine learning and deep learning, the new thing that's coming out in the into the literature. Yeah.
Well, clearly our audience has a lot of interest in AI, and I do too. And I have so many more questions I could ask you about AI, but we don't have a lot of time left. And there's a couple of other topics I want to get to. You are a retinal surgeon, so I feel I would be missing out on an opportunity if I didn't ask you the following question.
Sure.
What are we what are we not doing to protect our eyes that we should be doing? How do we avoid seeing a retinal surgeon? Give us some tips, please.
Okay, right. If we are both as young as 5 to 10 years old, my advice is, like the myopia in the East Asian population is a highly prevalent conditions. In Singapore, it's actually ranked, one of the myopia capital, right? We have one of the highest rate, unfortunately, of the high myopia prevalence around the world. How do we actually prevent myopia? And because myopia comes with a lot of sequelae and complications later on in the life, and how do we encourage the kids to go outdoors activities? So, I mean, for instance, I have a kid that I will make sure that, on a daily basis, he would actually at least have outdoor activities for at least 2 hours, right? So those are the few very simple and easy tasks for you to do for your kids if your kids are still at the growing age in the, between the...
Have them get outdoors so they're not looking at their tablets all day. Is that your point?
Yeah, that's right. Reduce the digital screen time. I think that is very important. Go out for for a walk or cycling, and I think that is really important, for especially for those people who have a lot of kids and they are at home. Yeah, that's right.
I was reading about the importance of blinking and how we need to constantly be blinking throughout the day to cleanse our eyes. But when we're looking at a monitor or a tablet, the body blinks a lot less. Now, is that a myth or is that true? And why is that?
Yeah. Okay. So we need to blink, but not overly blinking. All right. Everything has to come with moderation, right? So when you are very focused in reading or on your digital screen, because of the attention that you needed, and sometimes your brain just forget to blink, and that hence resulting in the dryness of the eye. But whether or not you have to blink on a hourly basis, you have the more you blink, the better for your eye. That is a myth. So I mean, we have to make sure that we don't actually, we have to read, and we have to read wisely, right? So I mean, those are the things that blinking definitely could help the distribution of the tear films on the surface of the eye. But overly blinking will not make you a very socially popular person too. So I mean, we have to make sure that you have to get a balance between blinking too much and blinking too little.
Sure. Yeah. So another thing that's interesting is that researchers are trying to see if we could possibly do eye transplants at some point. Do you have any insight about that?
Well, the eye transplant can be divided to a few different domains, and the most popular one is the cornea transplant. And cornea transplant is only reserved for those patients with unhealthy cornea, and the unhealthy cornea can be the reason from a few things, right? One is someone is born with some hereditary eye condition, corneal conditions that requires a cornea transplant. Some can be because of them having a complicated, the cataract surgeries, hence, that has decompensated the cornea. And those are so cornea transplant is one of the most commonly performed transplant procedure in eye. But the other transplant itself is not so, I mean, the outcome is not promising. So, I mean, hence I would not even trying to actually go there. If you need that, I think the best is to really come to see us and let us assess the cause of the problem, and then we can actually take it from there. Yeah.
One day maybe, but we're not there yet. We can't do full eye transplants yet because the eyes are so complex, the optic nerve and the process. We haven't figured it all yet. We're working on it though.
Yeah, that's right. Yeah, so I mean, it's not so much on the transplant, but more on the regenerative medicine. There's definitely a cell therapy and gene therapy that are available for patients with the poor eye conditions coming from the inherited the eye conditions and stuff. But definitely, transplant is one way. Regenerative medicine is also another potential solutions to that. Yeah.
Interesting. So when I was looking up eyes, I found a bit of trivia that the human eye can see 500 shades of gray. That's how complex our perception of color is. And of course, I was thinking of that book, 50 Shades of Grey. And you mentioned earlier in the conversation about Terminator, and Brielle from Singapore was joking that there's a reference in that movie that August 29th, 1997, Skynet becomes self-aware. So we're coming up on August 29th. But the point is, you seem to be aware of US culture. And part of the reason you're aware of US culture is you spent some time in the United States. So share with our audience where you were studying in the United States.
Yeah, thanks. I mean, yeah. So, I mean, as part of the Fulbright program, I had the privilege to visit Johns Hopkins. That was back in 2017. That was about 4 years ago, and I did a 4 months attachment with the applied physics labs as well as the School of Medicine in Hopkins. So I mean, yeah, it was really an eye-opening experience. I mean, I've before I went to Baltimore, I was briefed and I was warned about how it potentially sometimes the safety is something that one has to be very highly cautious about. And I've seen that the movie called The Wire was actually filmed in Baltimore, and all these things did not really add up when before I went. But I must say, like, after the 4 months, my experience with Baltimore has totally changed. People there are so academic. Everyone is talking about science. It's not so commercially driven and I must say, like, people live a very simple life in Baltimore, and their focus is at the right place. I mean, that makes Hopkins at one of the most prestigious university worldwide, right? Because of all these talents that Hopkins has managed to attract. And that was actually one of the best 4 months I ever had in my life. Of course, I must also say that actually was at the expense of me leaving my 3-month-old kid. I had, that was a sad part. And yeah, I know. So, I mean, I had to go to Hopkins by myself and leaving my wife and my 3-month-old kid behind. And we had a very long discussion with my wife, whether I should go, whether I should defer a year. And she said, like, I must be very, very thankful to her for being extremely supportive during that period of time. And yeah, so sometimes all this academic work does take hit in your social or your family life, and yeah, I can't thank her more for being supportive for me going. Yeah.
Well, I appreciate your wife too for letting you go and be part of the Fulbright program and develop your expertise. And it is true for every professional, we have to balance so many things in our life. And sometimes the social life takes a hit, but hopefully we have balance and you will be able to return the favor to your wife in many ways, I'm sure. We're just at the end of the interview, but maybe I can squeeze in one question that we got from Sarah, who is asking whether there are robotic eyes that can help blind people to see. Are we getting there? I don't think we're there yet, but maybe one day.
Well, I really hope, the robotic eye can come into fruition. And a lot of the studies that are being, done in these areas. And the closest to a robotic eye is something what we call the bionic eye implant, which is what we call is Argus 2 implant. So basically, it's an implant that one would be putting on the surface of the retina, and then with some wiring connection with your underlying retinas, And when you stimulate the implant, you could actually give the patient some perception of light so that, you know, they can actually navigate. But unfortunately, the technology is not as promising as, as yet. And, for someone to navigate or for someone to even walk, you really need to even start seeing some shapes of the objects and stuff. So whether or not, in the next 5 to 10 years or 15 years time, there will be new technology coming out to overcome such thing. And as you have rightly pointed out, the eye and the retina is full of millions of neurons in the retina. How these individual cells are wiring with each other is highly complicated and complex. So that is the reason, that is one of the limiting factor that why this domain hasn't really achieved promising potential for the past few decades. But I'm still hopeful that one day it will come. Yeah, and let's keep our fingers crossed.
I'm so excited by what you're saying. One, so excited about where technology is going and how creative humans are getting together to invent these wonderful things and solve these various challenges that people have. But at the same time, I'm also thinking how appreciative we all should be of our bodies, our eyes, our brain, the wonderful gifts that we have and the complex thing that is this body in which we live. And we're working really hard to create mechanical solutions to problems, and nothing replaces the real thing, at least not yet. Anyway, I wanted to ask you another 40 minutes of questions, talk more about AI, talk more about eyes, talk about your experience in the States. I wanted to talk about Singapore, but we are getting past our time, and I just want to thank you for being such a great guest. I want to thank our audience for great questions. There's so much more we could talk about. I hope we get to invite you to another program. Maybe we can have another chat. But to go back to the beginning, we're both very concerned about COVID. So to our audience, stay safe. The Delta variant is still raging. COVID is still with us. Let's support each other. Let's listen to the advice of the medical professionals. Let's do what we can to get through this pandemic together. So again, Daniel, Dr. Ting, thank you so much for joining us for the show. Thank you so much.
Thanks, Jason. And please make sure get yourself a vaccine, right? I mean, please vaccinate yourself. Yeah. Very important.
Yeah,
thanks. This is one of the last things that I wanted to make today. Thanks.
To everyone in our audience, if you can get access to a vaccine, we're very proud as members of the US government that we are working so hard to get vaccines to countries throughout the world in need. We've donated more than 23 million vaccine doses to Southeast Asia. So if the vaccine is available and you need one, see what you can do to get it. If you're, especially if, when I say need, I mean, everyone needs it, but if you're in a vulnerable segment of the population in particular, see what you can do to get one. So, okay, well, we're gonna have to wrap up, but I don't want to. I want to keep you here, but I can't. We're gonna have to wrap up. So again, thank you, Dr. Ting, and thank you to our audience. Until the next time.
Thanks, everybody. Thank you.